right, welcome back. Thank you so much for rejoining us here on the Now Morning Show. The technology is fantastic. You know how it is, but we're doing our best. On Zoom with us this morning is Tracy Davidson-Celestine to talk to us about what's happening in Tobago with the parallel healthcare system, as well as how the SOE is affecting things over there. Good morning to you, Mrs. Celestine.
Good morning to you, Natalie. Good morning to all of Trinidad and Tobago.
Thank you so much for joining us this morning. So the last time I heard it's that the parallel healthcare system in Tobago was at 75% capacity. Has that increased since?
Well, it was reduced recently because we had a number of discharges, and that is persons leaving the facility. And right now we are at a place where it's about 66.6% in terms of the occupancy at one of our facilities, and then just about 74% at the step-down facility. So there is still some capacity, but of course we are managing this situation.
Okay, well, I'm definitely happy to hear that. But how do you expect that the state of emergency is going to affect things in Tobago? Do you think it will help with the reduction of spread? Because we are having some cases in Tobago as well.
Well, of course, Natalie, you see, in this battle, it requires the support of not only the people, but the central government as well. And so all of the initiatives that the central government has to date implemented has assisted us in the island of Tobago. And so the state of emergency at this time is just one of those strategies that, of course, will help to restrict the movement of people. You would know that the more people move around, the more the virus will be spread. And so whether it is the state of emergency, whether it's calling for a limitation in terms of sport, in terms of the numbers congregating, all of those measures to date have assisted us on the island.
But I know things are a little bit different in Tobago from, how they are in Trinidad. What has the response of the business community been? Because somehow I was saying this morning that here in Trinidad, we always seem to believe that we say that we are supporting the measures, but, livelihoods are affected and the economy and, the numbers. Is that the same kind of response we're getting in Tobago?
Yes, of course, it's the same all around Trinidad and Tobago internationally. You would know that we have been locked in for quite some time now. I think it's probably about a year and 2 or 3 months or so. And so businesses are suffering in terms of their bottom line, in terms of their profitability. I would hear that it's, now very difficult to pay bills in some instances. So the complaints are the same. Overall, we in the Tobago House of Assembly, we will try our best to assist the businesses as much as is possible. And over the last few months or so, we have been distributing grants from the Division of Community Development and Labor, grants from the Division of Tourism and Transportation. And then, of course, we try to assist with the social side as well in terms of providing rental assistance. But there are challenges out there. Of course, it's a balancing act. It's about preserving lives as much as possible. And that is really our priority at this time. Once as we have the required behaviors, I am of the opinion that, things will open up and we are seeing the light at the end of the tunnel in terms of those developed countries where they are now taking measures that would indicate that once as people are vaccinated, things can return to pre-pandemic stages. And so eventually, Trinidad and Tobago will get to those levels as well.
Well, I think we're all looking forward to that, but we know it's still going to take some time to get there. But tell us how many people have been vaccinated so far on the island in terms of first dose or even, both shots.
Well, we have just about 4,900 persons on the island to date. We expect to receive another batch of vaccines when the batch arrives into Trinidad. And of course, there is some vaccine hesitancy on the island. And on Wednesday, we will embark on an education program where we will have doctors, we will have representatives from the PAO talking to people about vaccines and giving them an opportunity to call in to indicate what their fears are, and of course to ask questions. So that takes place on Wednesday from 5 to 7 and on all major channels on the island.
In terms of Tobago, though, are we having any vaccine hesitancy, or are people, coming forward and, doing and taking the vaccine without any doubt or hesitancy, towards all the things that we've been hearing over the place?
Well, there is vaccine hesitancy. When you look at the statistics, we have a significant percentage of it in Tobago East when compared to Tobago West. So far, the majority of persons who have come out to receive the vaccines to date are people in the greatest number from the western side of the island. So based on that, we are seeing hesitancy from northeast of Tobago and also Tobago East in total. There is still some amongst the healthcare workers as well. And as I indicated earlier, that is why it's important for us to embark on this education drive, because the fears are real. When you talk to people, they tell you about all kinds of conspiracy theories that they have read online or in their research, or that they have heard probably in the public domain. So as I said, this education program that we will have on Wednesday and which will continue will help hopefully to alleviate some of those fears by allowing persons to call in and have their questions answered. But then again, when you look, we tend to look at what is happening in the United States of America, and we tend to look at what is happening in the UK, etc. Over 200 million persons have been vaccinated in the United States of America alone, and we have not received any untoward report just yet to indicate that the vaccines will not work. Coming back in the context of Tobago and Trinidad and Tobago, I have received the vaccines and I've been leading a very healthy life to date. So they are living live examples of people who have taken the vaccines and who have not had any significant effect. So we're hoping that that information could at least be the impetus for persons to come forward to taking the vaccine. But there are still some real fears out there.
Right. And so you say Wednesday from 5 to 7, how do people access this information that the Secretary of Health will be having with PAHO?
Well, it will be online, and then the major radio stations on the island, Channel 5, we have 92.7, I think there is 91.1, and I think Pulse and all of the major radio stations live on the Division of Health and Wellness Facebook page as well.
Yeah, well, I really hope that people take the opportunity to tune in, or to go online so that they can get the necessary information to help them. Because as you said, it seems as if the only way out of this is the vaccination. So let's hope that people really, take the information so that they can learn more, because a lot of times who we have educating us aren't really equipped to be telling us anything. And, in the absence of proper information, then we run with whatever we have. But I also know, I think it was Anthony Thomas, one of the doctors out of Tobago, talking that, we need more contact tracers in Tobago so that we can catch the cases, we can catch the people who might be affected. How are you going to treat with that? I think I heard that you had 10 contact tracers.
Yes, and from this morning, I think it will take effect from tomorrow rather, we will be engaging some persons on short term to assist in the contact tracing department out of the Office of the County Medical Officer of Health, because of course, the numbers fluctuate. And so every time it increases, we have to find additional resources to outfit that particular unit. So we have been focused on engaging persons in that particular unit so that we can treat with all of the contact tracers, because you would know one person sometimes may generate as many as 10 to 20 contacts, especially if that person is an active person. And sometimes, based on the discussions that we have had with the contact tracers so far, they may call 100 persons on a daily basis, to monitor, to follow up, and of course, to share information in terms of how they are to proceed. And it is a challenging time, a very challenging arrangement. in the TRHA and also the Department of Public Health. But at the end of the day, we will redeploy resources accordingly to help them to fight the spread of the virus.
Right. So obviously where we are now, there's still a lot that has to be done in such a way that we can continue not to experience the kind of spread in Tobago that we're having in Trinidad. But as of now, how many active cases does Tobago have?
Well, as of yesterday evening, we have approximately 77 positive cases on the island, and that includes 13 new cases. Unfortunately, we have had 4 deaths to date, and the discharges are rolling in, so it helps us to manage the numbers and, of course, the capacity at our facilities of care. Samples tested positive is approximately 312, and we have just about 9 samples at the lab awaiting results. So those numbers can change by 12 o'clock today. We have one patient in ICU is considered to be stable, not critical. And overall, we have tested just about 4,959 persons so far in terms of those who have come forward to be tested.
Right. Well, it seems that at least for now, that the amount of people tested and the amount of people testing positive, we haven't gotten to 10% as yet. So that is definitely good. But in terms of going forward, Mrs. Celestine, apart from this education drive about vaccination, what else is the Secretary of Health and the Division of Health and Wellness going to do to ensure that people understand the gravity of where we are and what they need to do to stay safe?
Well, the thing is, Natalie, I am thinking that people are getting the message loud and clear, especially when they look and see what is happening over there in Trinidad. People are getting the messages, and when the numbers roll in, you would see hundreds of persons coming forward and being positive with the virus. So it's a scary time for all of us here in Tobago as we look on as to what is happening there in Trinidad. But more than that, we intend to, there is greater collaboration with the TTPS. Of course, they have to assist in enforcing the regulations, ensuring that persons are not out with this new state of emergency, and ensuring that persons wear their masks during the daytime. And of course, that persons follow the quarantine rules and regulations. We are also focused as a part of our contingency planning on ensuring that we can identify additional space, and we have done that so far. But we're still, knocking wood that it doesn't go, the positive cases don't go beyond a certain number. We also understand that there would be the financial and, of course, the mental toll climb on our persons out there. So we will have our counseling unit very active at this time. And they are supposed to have their hotline rolled out on Wednesday latest of this week. And in the interim, persons can call in, and there are 1 or 2 persons who have been coming in to access counseling support in a very direct manner. Our social assistance grant programs continue in terms of providing rental and food support assistance. And the food support comes both from the Division of Health, Wellness and Family Development and the Division of Finance and the Economy. And the Division of Health, Wellness and Family Development will treat with rental support. Then, of course, there are the grants for the businesses as well. And then we have the education awareness program that, as I said, will start Wednesday of this week, where we will be alleviating fears. And finally, our approach is to ensure that we ramp up the vaccination drive as much as is possible. So when we receive those batches, there are certain courses of action that we will take in terms of going out into the communities, going to the elderly homes, so as to ensure that we vaccinate those persons who are easily considered to be vulnerable. And then, of course, it requires a collaborative approach with the central government in terms of financial support and ensuring that the laws are enacted in a particular way to give effect to restricting movement as much as is possible.
Right. So is the protocol for vaccination similar to what happens in Trinidad? Healthcare workers, those with comorbidities?
Yes, it is. It is very similar. When we started, we had a priority listing of persons to be vaccinated, and as you rightfully indicated, persons over 60, especially those who may have comorbidities, healthcare workers, and then of course we had the essential workers being vaccinated. So it's basically the same.
Assemblyman, what's his name again? Is Tevon? How did he feel that he would have been vaccinated in the first batch of vaccines?
Well, the thing is, I am of the opinion that Kelvon would have articulated that very well, and he was not vaccinated in the first batch of vaccines. I think it was probably only last week or week before that Assemblyman Kelvon Morris received his vaccine. So that was publicized in a particular way, but the information wasn't accurate at all.
No, but even so, does he fall into the category of somebody with comorbidities, a healthcare or a frontline worker? I'm trying to figure out even now how he got vaccinated, or is it as an assemblyman that you all are vaccinated as well as assemblymen?
Yes, and of course, you would have seen ministers coming forward to be vaccinated. And so it was the same in Tobago, where at that point you had assemblymen coming forward, those who are interested, coming forward to be vaccinated as well.
Are there assemblymen who aren't interested in being vaccinated?
They would prefer to defer their vaccination to another time, as I saw in the news when the question was asked.
Interesting. All right, Tracy Davidson-Celestine, I want to thank you so much for speaking with us this morning, and let's hope that Tobago can continue, to keep things, in a kind of stable way that I think it is, because we really need these numbers to go down. So I hope you all continue to stay safe in Tobago, and that the people in Trinidad will adopt the psyche of the people in Tobago.